Good morning, Chicago. I'm Dr. Allison Already, Commissioner at the Chicago Department of Public Health. And as always, this is your chance to get your COVID questions answered. First, thanks to the many of you who have been writing in nice comments, sending me pictures of kids getting vaccine, and just generally being positive and excited, as am I, about the fact that we've been making such good progress in getting 5 to 11-year-olds vaccinated. Today is Tuesday, November 16th, and we will be here today and then most likely on Thursday, although there's some possibility we may actually repurpose Thursday to do some additional outreach for City of Chicago employees. We'll actually be off all of next week for Thanksgiving, so we won't be doing Facebook Live either of those 2 days. So today is really your best day to put your questions in, so you can go ahead and put them directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. But before we get into your questions, let's take a look at the dashboard. So chi.gov/COVID- is where you always are going to pull up the latest numbers for the City of Chicago. And you can see that just like across the Midwest, cases continue to be on the increase. We're averaging 445 cases per day right now. You can see that's up 10% from a week ago. Hospitalizations are down a little bit, but they tend to lag, and we also often get a bolus of reports in after the weekend. We're averaging about 3 deaths a day still, and doing about 22,000 tests. You can see that the testing is actually down 5%. So it is a true increase. It's not being driven by testing here. And in the setting of cases being up and testing a tiny bit down, not surprisingly, our positivity rate is also up 2.5% compared to 2% from a week ago. I do want to highlight, though, the vaccination news is looking really good. We're going to do a press conference with CPS this afternoon at 1 o'clock to talk in some more detail about Protect Your Health on the 12th, which was our effort last Friday to really get people vaccinated. CPS had the day off. But quick spoiler here, do you see this day right here that's sticking up above 20,000? That was November 12th, and that was the most vaccine that we had done here in the City of Chicago since May 15th. So really, really pleased with the uptake there. And let's just, because we have a minute, dive into a little more detail on vaccines, show you some of the updates that we've been making. So for one thing, you can actually look and see now over the age of 5. So 71% of all Chicagoans over the age of 5 have gotten a first dose of vaccine, and 64% are fully vaccinated. You can also look at, the daily average doses, percent vaccinated over time. Let's look at age here just to get a sense. Look at this pretty graph. So this is first doses of vaccine by age. And so the dark blue here are our 12 to 17-year-olds. You can see we had, back when they became eligible, we peaked out right here with a daily average of about 3,178 12 to 17-year-olds getting vaccinated. And we've already surpassed this here. See this in the green? That's our 5 to 11-year-olds. So we were up 378% in that age group since the prior week. You can see many of the vaccines, most of them, are in that youngest group. Right now we're averaging more than 3,000 a day in 5 to 11-year-olds and fewer than 500 a day in the other groups. We did see some increase in the 12 to 17-year-olds, but still I'm concerned that we have about a third of Chicago's teenagers not vaccinated, and they are very much driving a lot of our COVID numbers. So I encourage you to continue to explore if you want to take a look at what's happening with race, ethnicity. We've seen, you can see here too, actually, some nice increase across all race ethnicities. Red is white non-Latinx, blue is Latinx, green is Asian non-Latinx, and purple is black non-Latinx. And with that big push over the 12th and last weekend, very pleased to see that looking the way that it does. So I'll encourage you to continue to explore that yourself, but let's go in and look at a little more detail on some slides here. So first of all, where do these numbers put us? We remain in the high transmission, the high risk state as a city, where we're between 400 and 800 cases a day, and I do expect to see that continue to increase. Our test positivity at 2.5% has come out of the low and back into lower transmission. It's still good. Under 5% I'm happy with, but it does continue to increase. You'll see our hospital bed numbers are going up. We're currently averaging over the last 7 days 235 Chicago beds occupied with COVID-19 patients, and that is getting toward the top end of this lower transmission or lower risk. So we may see that move into substantial transmission. Our ICU beds, on the other hand, are relatively stable. We've got about 60 Chicagoans in the ICU with COVID right now each day. And that's good news. Most of that is because the most vulnerable Chicagoans are the most vaccinated. Older Chicagoans, those with underlying conditions. And so we're not seeing as many ICU admissions, which is certainly good to see. But I'm a little worried about this hospital increase. You know, as cases are going back up, no change from what we've seen previously. It is largely unvaccinated Chicagoans who are, by and large, getting COVID. Even just during the Delta surge, unvaccinated Chicagoans remain more than twice as likely as vaccinated Chicagoans to be diagnosed with COVID. And you can see that growth is the largest among unvaccinated. And I really want to highlight one thing that we're seeing now is that as of last week, unvaccinated Chicagoans on the left here by age continue to drive our COVID outbreak. And the highest case rate in Chicago is now in unvaccinated 12 to 17-year-olds in this light blue here. You can see the sharpest, most recent increase and the highest rate among unvaccinated 12 to 17-year-olds. Followed by unvaccinated people 30 to 59, followed by 18 to 29. Where we look at breakthrough infections, you know, they're much lower than among those who are unvaccinated. And 12 to 17-year-olds actually having the lowest rate of breakthrough. This is an important slide. I'm going to highlight it again this afternoon. These unvaccinated teenagers are not only driving a lot of our outbreak right now, but they are at much, much higher risk of getting COVID. Just here in Chicago, just during Delta, if we look at 15 to 17-year-olds, unvaccinated 15 to 17-year-olds in Chicago are 7 times as likely as their fully vaccinated counterparts to have been diagnosed with COVID during our Delta surge. And unvaccinated 12 to 14-year-olds are more than 10 times as likely. So the non-dashed lines are our unvaccinated 12 to 17-year-olds, and the dashed lines are our vaccinated teenagers. So certainly we've been working with CPS, and if people have questions, happy to address it. But while we continue to work on 5 to 11-year-olds, not wanting to take the focus off those 12 to 17-year-olds. Similarly, the rates get even more dramatic when we compare unvaccinated and fully vaccinated Chicagoans being hospitalized with COVID. So unvaccinated Chicagoans more than 5 times as likely. And again, if we look at this, we've seen just over the last week or so quite a sharp increase in yellow there in older Chicagoans over age 65 being admitted to the hospital with COVID. So you see that in the other age groups, the hospitalizations have been relatively flat. At the bottom there are the 0 to 17-year-olds, luckily much less likely to be hospitalized. But that increase in 65 plus I do worry about. And still, by far, the risk factor there is being unvaccinated. So you can see on the left, this is hospitalizations now, that unvaccinated Chicagoans of all ages more likely to be hospitalized, even than the oldest vaccinated Chicagoans. But the highest risk there in gray are our unvaccinated Chicagoans over the age of 60, where we've got 50 per 100,000 per week being hospitalized. And then on the right is the breakthroughs. Breakthrough hospitalizations remain rare, but where we do see them, again in the gray there, it tends to be in those over 60, which is why we've been really encouraging everybody who's older, has an underlying condition, please get that booster now, just to help keep the breakthroughs down. But by far, my concern remains the left side of that graph. And then death rates, similarly 7 times the risk of death for unvaccinated versus vaccinated Chicagoans, just even during the Delta surge. And by age, older unvaccinated Chicagoans are by far the most likely to die from COVID-19. Similarly, on the left there, you see what the current rates are looking like for unvaccinated. So 10 per 100,000 Chicagoans over 60 dying. Whereas on the right, very, very low numbers of breakthrough deaths. And if we look in a little more detail here in Chicago, the vaccines continue to work really well. 98.9%, almost 99% of fully vaccinated Chicagoans have not tested positive for COVID-19 after being vaccinated. More than 99.9% have not been hospitalized. And again, where we see breakthrough hospitalizations, the median age here in Chicago is 67. It's these older folks for the most part. And then more than 99.99% of fully vaccinated Chicagoans have not died due to COVID-19. The median age of breakthrough deaths in Chicago is 77, and nearly half of those folks are moderate to severely immunocompromised. The most common diagnosis is active cancer treatment, getting chemotherapy, for example. And one of the reasons we really obviously are encouraging boosters, but also encouraging others to get their vaccines, is that people who are immunocompromised, the vaccine is the least likely to be fully protective in them. Okay, we've also gotten some questions in about what's happening with CPS, so I thought I would just highlight where we are. Overall, we have seen the COVID-19 case rate increase in the past 2 weeks, but nothing out of proportion to what we're seeing in the community. And over again, this is what we see. Whether we're talking about public schools, private schools, charter schools, the biggest predictor of what the COVID case rate is in the school is what is the COVID case rate in the community. And so since the start of the school year, still 0.99, not even 1% of CPS staff and students have had a positive COVID test and been present. Last week, 0.11%, about 1 out of every 1,000 staff and students were diagnosed with COVID. That's steady from the prior week, but it is this increase of about 30% going back to the week of October 24, which is when we also started to see the increase at the community level. So nothing unexpected here. If you look at this graphically, the light blue represents cases in students, the dark blue represents cases in staff, and you see, compared to October, back on the increase, but nothing remarkable or out of proportion with what we've seen in the community. In that same setting, the quarantine and isolated staff and students, as a reminder, anybody who is fully vaccinated does not need to quarantine, assuming they don't develop symptoms. And so we expect this number, as more kids are vaccinated, to go down. But the total number has increased a little bit as cases have increased of students in quarantine. So again, no surprise there. And where we look at screening testing, last week we had about 4 out of every 1,000 valid tests be positive. And that's a little higher than we've seen, again, consistent with higher rates in the community. Cumulatively over the whole time, about 3 out of every 1,000 tests have been positive. And then related to clusters and outbreaks, since the beginning of the school year, there have still been across all CPS schools just 33 clusters or outbreaks that have been detected, investigated, and reported. And these remain small. 20 of them are just 2 people, where we can't rule out the potential for in-school transmission between 2 people. 12 of them have been 3 to 4 people. There's 1 that includes 5 people. And most of these, 58% of them, include students only. Some include staff only, and then some include both staff and students. So again, really confident by not just in CPS, but in schools across Chicago that there are good mitigation measures in place, and getting more kids vaccinated, along with, of course, making sure the adults are all vaccinated is the key. Just want to finish out by reminding you that now is the time to get vaccinated in advance of the holidays. Even 1 dose before Thanksgiving starts to build that protection. And because children can only get the Pfizer vaccine, Children need a first vaccine dose by this Saturday to be fully vaccinated by Christmas. So November 20 is the cutoff date for your first dose of Pfizer. For Kwanzaa, it's November 21st, Sunday. So I hope we see a lot of families really taking this week and next weekend to keep those numbers up and be able to make those winter holiday gatherings even safer. And then finally, just a reminder that open enrollment, meaning the opportunity to enroll in health coverage in the marketplace, opened November 1st and is open through January 15th. So if you don't have health insurance right now, or you know somebody who doesn't have health insurance, they need to go to getcoveredillinois.gov. And there's more details and connections on there. They'll get you set up with a patient navigator, help you pick a plan. There are low or even no cost plans available for people who are lower income, but this is really a critical way, and now is the time to sign up. You have to enroll by December 15th to have your coverage start on January 1st. So again, please check getcoveredillinois.gov if you or anybody you know is not covered with health insurance right now. And you're not obligated to purchase it when you investigate it, but we want to make sure people have the information. And quite often people don't realize that they're eligible for very inexpensive or free health insurance. So please spread the word on that. Okay, let's go ahead and get into your questions. All right. Heidi Lee from Twitter says, is it dangerous if a child received the COVID vaccine while having COVID, in case we didn't know? So it's not dangerous. Certainly, we want kids who have COVID to complete their incubation period, meaning they need to be home for the full isolation 10 days before getting the vaccine. But there's nothing dangerous about it. You've basically just given a little bit of an extra booster. I often get a corollary question to this about, if my child has COVID right now, how long do I need to wait? You actually don't need to wait to get your child the vaccine as long as their symptoms have recovered, their symptoms are no longer occurring, and they've recovered, and they're at least 10 days post their diagnosis. But no, I would not be worried about that in case a child did get the COVID vaccine and had COVID that they were not aware of. Lisa Marie Quinlan from Twitter. Will the children receiving vaccines need a second shot? Great question. Yes. So because the Pfizer vaccine is the only vaccine that is available for anybody between the ages of 5 and 17, it's really important that kids get the second shot, just like adults. As a reminder, the dose for children 5 to 11 is only 1/3 the dose of what is given to the older teenagers or to the adults. But that second dose comes 3 weeks after the first dose, and it's fine if it's plus or minus a few days. But we want you to get that second dose on time, because the protection in the trials for the 5 to 11-year-olds, about 91% protection after getting vaccinated, but you had to get both doses of the vaccine. And that's really how this study was done. So that is the strong recommendation, and please make sure. I got a question last week. Someone asked me, I got my first vaccine back in May and I never actually got my second. Is it too late? No. Go get your second now. It still counts, but it's really important if you got Moderna or Pfizer to get the second dose. Jesse Akins from Facebook is asking a few times here, can you hug family and friends if you have all had COVID shots? Yes, you can hug family and friends if you have all had your COVID shots. One of the main reasons that we promote COVID vaccines so hard is that this is what allows us to get back to the things we love in life, including hugging family and friends. So, ideally, everybody would be fully vaccinated in this setting, meaning they're 2 weeks post their second dose. But even if you've got, a grandchild who's had just that first dose, and the grandparent, for example, is fully vaccinated, I would not have concerns about hugging. We got some questions in. Also, people have been asking about how to safely gather around Thanksgiving with children not yet fully vaccinated. And the advice I've been giving is, as always, if everybody that is together has had at least their first dose of vaccine. That's a fantastic start. Obviously, the younger children are not yet eligible. And if there are older folks, we do want them to have had both of the doses of their Pfizer or Moderna, and then really to get a booster if they've got an underlying condition, if they're living or working or otherwise concerned about being in a higher risk setting for COVID, and anybody who's over 65. So if everybody's had their as much vaccine as they're eligible for, I'm really not worried about people gathering for Thanksgiving. If you want to be extra careful, there are people who are doing like an at-home test even the day of the gathering. And you could do that if you've got younger children, for example, who are not vaccinated yet, or anybody else who you're concerned about, especially if there's somebody who's immunocompromised and you're extra concerned. But by and large, yes, when everybody's had their COVID shots, you can hug, you can gather. The risk goes down so much, especially if everybody who's gathering has COVID, that we can basically have a normal Thanksgiving gathering, and that's all thanks to vaccine. Alexandria Deanne on Facebook is saying, several of my friends' kids have been ending up in the ER with respiratory conditions, but testing negative for COVID in the last week. Is this a bigger trend? Is there any possibility it could be linked to COVID? They've been needing oxygen, but overall have been okay. Yeah, so good question, Alexandria. This is right when respiratory virus season comes every year in Chicago. And when I say respiratory virus, I'm talking about the whole host of the cold virus, respiratory viruses, flu virus that starts to spread, especially among children, especially as we move indoors. And for the same reason that the flu season is just starting to really get going here in Chicago, some of the other typical viruses for children are also on the increase. So it is not a surprise to me at all that that is happening, and certainly encouraging children to continue to wash their hands where they are masking. That does also help with some of these other respiratory viruses, but I don't think that it's linked to COVID, and the tests are very good that are being done generally. It's more that we are gathering again in ways that we were not previously, and so last winter we saw very little respiratory disease among children. I've had a number of pediatricians on talking about how last year was such an unusual year. They were very, very rarely having to treat kids with the most common viral illnesses. They weren't having to give out a lot of antibiotics when kids got bacterial infections on top of viral illnesses. Ear infections were down, RSV was down, flu was down, you name it. The typical infectious childhood diseases were down, in large part because of how much we had changed how we were interacting. But we're now sort of back at it, and where rates of COVID vaccine are relatively high, I don't know the age we're talking about here, you'd be less likely to see that and more likely to see other viruses. So I'm glad they're doing fine. When I hear about kids needing oxygen, that is the kind of thing you do want to be bringing kids into the ED to be getting them checked for. If kids are having trouble breathing, that is not something we just sit on. That's, we never want you bringing in a child to the emergency department just to get a test, for example, if the child is otherwise feeling fine. But if they're having trouble with breathing, that is a reason definitely to bring them in and get them checked out. Connie Zhang from Facebook says, what would you recommend for an 11-year-old who is a few months from turning 12, given the different dosages? Yeah, good question, Connie. I would recommend that your 11-year-old get the 5 to 11-year-old dose now. I would not wait a few months for the 12-year-old dose. There's not a magic cutoff per se, but in the studies, the reason that dosing has been done, it really has to do, it's not so much about the size of the child or the body mass of the child as it is how mature the immune system is. So as opposed to waiting for your child to turn 12, if it's a few months from now, go ahead and get them with their 2 doses for the 11-year-old, and I would rest easy at that point. Much less risk of getting COVID with that than waiting a few months. The difference is sometimes people ask if I'm a few days away. A few days, fine, but a few months, no. Go ahead and do the 11-year-old vaccination now. All right. So Carol Miller on Facebook says, I went to the Grand Canyon this past week. Congrats. I am vaccinated and I wore a mask. Very good. Should I get tested before visiting family in 10 days? There's a 4-year-old and a 1-year-old I will see. The others are vaccinated. So I would say, the reason that we don't have any, around our travel advisory, it's really focused on folks who are unvaccinated is because the risk is so much less. If the visiting in 10 days is related to Thanksgiving, which it very well may be, I'm never going to encourage somebody to not take a test. If they're thinking about it and you've got a home test available, especially knowing that there are little ones who are too young to be vaccinated, I think your risk is very low. If you've not really had symptoms, you've gone through, those whole 10 days, the risk is low. So I would not say you have to get tested, certainly. I think, again, low risk. But if you are, seeing some people who are going to be unvaccinated and you've got a home test available, again, they're inexpensive. You can get them online. You can get them through Amazon, Walgreens, Target, Walmart. All the pharmacies have them. I keep them at home, and I like to just take one. In case I have even a little bit of symptoms, or I'm going to be seeing somebody who has an immunocompromising condition, too young to be vaccinated, et cetera. So I think just to help everybody's peace of mind, you could take a test, but I don't think it's necessary. Faith State from Facebook. Are there drive-through vaccination sites, and when will children under 5 be able to get vaccines? So there are a few drive-through vaccination sites. Really, once we get into this time of year, the drive-through sites are not as ideal, simply because where you think about the people who are working the vaccine sites and needing the dexterity with vaccinating, et cetera, it's actually harder to keep staff warm and protected, and we have more problems with weather. So there are some of the hospitals have been doing some drive-through vaccination sites, Swedish, for example, up north. And then there are some pharmacies also that certainly do drive-through testing, but we've seen a few that have been doing drive-through vaccine. Really, though, the main focus where you're going into a healthcare setting, folks are vaccinated in that setting. The risk is not great in that setting, and we're not needing to do as much of sort of the mass vaccination like we were at the United Center, just where we look at the numbers. So there's plenty of vaccination sites. We're up to 126,000 vaccinations that have been distributed just for 5 to 11-year-olds all over the city, about 200 sites. We did not have trouble keeping up with demand, even though we broke all the records last Friday and continued to see good uptake Saturday and Sunday. But for example, each weekend where the city is standing up at city colleges, every Saturday and Sunday, we're standing up these larger vaccination sites. We did more than 700 vaccinations at those sites, but they were not drive-through. They're inside, in the gym or the library type setting at city colleges, where we can move hundreds of people, but we don't really need to be doing that drive-through status. And then Faith State is also asking, when will children under 5 be able to get vaccines? I don't know for sure. The studies have already been going on for those younger children, actually all the way down to age 6 months. I've got some friends who have kids who are in that very youngest cohort that are in the studies. Some get the real vaccine, some get the placebo. And like everything, they're looking at dosing, they're comparing side effects, they're looking at efficacy. If I had to guess, I would guess we will probably see this in 2 more cohorts. Really, those youngest children are going to be vaccinated at pediatric offices. And that's been some of the planning, where you're thinking about, especially the babies, really the most appropriate place is in pediatric settings. Pharmacies here in Illinois, pharmacists can vaccinate down to the age of 3. So we may see some 3 and 4-year-olds get vaccinated in that setting, but really under that, we are going to want them in more pediatric healthcare settings, and the parents tend to hold them. There's a little bit of a different approach for those very youngest kids. But if I had to take a guess, I think we will see Pfizer again first, and I would guess we will first see it for 2 to 4-year-olds, and that could be very early 2022. There's some possibility it could still sneak in December. I kind of doubt it. I think it's more likely to be sometime in the first quarter of 2022. And then most likely the last would be the 6 months to age 2, which is probably a couple months behind that. There's some chance that they may actually have enough data and have enough kids and time frame that we could see the 6 months to 4, but I think it's more likely we'll see it in those 2 tranches. So we'll keep you posted, certainly as we have more information. Just like for the other ages, first, we'll see some of the companies sharing that they've completed data collection, shared some of that, then it goes to the FDA. There's a whole process. But especially, the data for the 5 to 11-year-olds is looking great. No surprising issues at all related to safety. The side effects have really been low. Most kids are having no side effects or just a little bit of a sore arm. We've not seen any issues with really anything serious or unexpected there. So that is good news. And of course, we have to make sure that that's the same for those younger kids. All right. Michael from Twitter, what's happening with Europe? It looks like they're going into lockdown again. Do you predict we'll see the same thing in the US? Yeah, so we've been paying a lot of attention to Europe. Eastern Europe in particular is really doing poorly from a COVID perspective, and that's mainly because that's where the vaccination rates are the lowest. You look at Portugal and Spain and France and Italy, where the vaccination rates are higher, where the weather is warmer, they're doing fine. But where you look on the east, like Romania, Poland, etc., Russia, they've all been having some of the worst COVID outbreaks that they've had to date, largely being driven by people who are not vaccinated. And then we've started to see that move over Germany, Austria, Greece, all having the most COVID they've had at any point to date. And so we have started to see some variations on quote-unquote lockdown. Austria in particular is interesting to me because they made a decision. It's not really a full lockdown, but they said that people who are unvaccinated can only leave home for essential reasons like getting groceries, going to get medical care, or going to work or school. So they're not actually keeping them out of work or school, but they're limiting the less essential things to do. And then there's no restrictions on folks who are vaccinated. So that is a different approach than we have seen anybody else take. And certainly our team will be watching some of that data closely. But yeah, it's certainly of some concern. That's cold weather. I am not, honestly, I never have a full crystal ball in terms of what's happening. I am quite confident that we are quite well vaccinated here in Chicago. I'm very proud of the fact that to date, since we fully reopened way back last spring, we have never had to put any restrictions on anything that we've done since. We've not had to put restrictions back on dining. We've not had to limit the number of people in spaces. We've not had to close any events. Sometimes organizers have made a decision to do that themselves. And as we look ahead to the winter, can I say for sure that all of that will remain true? I can't, but certainly the goal is for that to remain true. I think where settings are fully vaccinated, I see very little, there's not really indication for doing some of those shutdowns. And I'm certainly not expecting to see the major lockdowns like we saw early on. The vaccine has really changed that whole calculus. I would say if in a worst case scenario, we saw a new variant emerge that the vaccine was truly not protective against, all bets would really be off. But assuming the good news is almost 100% of the virus that's being detected here and around the state, around the country, remains that Delta variant, that's good news in terms of not seeing a new variant yet outcompeting it. So that's one of the questions. Sarah Garza from Facebook, should people age 60 and over get the booster now, or should they wait until the 6 months after the second dose? Good question, Sarah. You should wait for 6 months after the second dose, assuming that you got either Pfizer or Moderna. And that's just because the protection is good, really. It's especially good in those first 3 months, but it's really thought to be good for the 6 months. So I would not start trying to get boosters early. I would do the 6 months and then get your booster at that point. Good question. Okay. Maria is asking, it sounds like cases are up in 12 to 17-year-olds. What is CPS doing to promote vaccinations in this age range, given all the attention on 5 to 11-year-olds right now? Yeah, good question. So certainly a lot of the focus has been on 5 to 11-year-olds. We saw the best day for vaccinating 12 to 17-year-olds on last Friday, Protect Your Health on the 12th, that we had seen since early August. So we did see some increase, but not the numbers that we'd like to see. I can't, we're going to have a press conference this afternoon with CEO Martinez. They'll be talking some about the CPS efforts. But I can tell you from the CDPH standpoint, we've already been partnering with CPS to really put some additional focus on schools where vaccination rates are much lower. Some of those tend to be especially on the south side and then directly west. We have more Black Chicagoans who attend school in those areas, and the biggest predictor of whether or not a child is vaccinated is whether or not their parents are vaccinated. Our lowest vaccination rates still, where you look at people who have been eligible for a long time, are among young adult Black Chicagoans. And so, for example, not only have our vaccine ambassadors been working with neighborhoods and with schools, but our call center that not only you can call still 312-746-4835 7 days a week. There are folks there who will take your call, who will get you set up for an at-home vaccine, who will answer your questions about boosters, who will figure out where to get your child a vaccine. They also, when they are not taking incoming calls, we do outgoing calls, and we call out to particular groups that are at higher risk, people who are in that oldest age category and on Medicaid who don't have a record of vaccination, and try to get them at home. We also did some calling out in some of the least vaccinated schools in that 12+ group, and really tried to reach all the families individually, have that conversation, sign up for at-home vaccine. We don't always get people signing up. And this is where, particularly with CPS, we're wanting to work very much with each school, do a focused attention, not just on, vaccines available, but having those conversations, working on where trust exists within school communities, building on that. And that'll be a big focus for sure going forward. Okay. Rika Pobre Servet from Facebook says, my parents received Sinovac in the Philippines. They're home now. Can they take the Pfizer booster? Yes. You can get the Pfizer booster even if you got one of the overseas versions of vaccine. So no problem with that. And assuming your parents are over 65 or they're over 50 or they're at a high-risk setting, yes, please do have them go ahead and get a booster. Good question. All right. We're just about coming up on time here. James Ross from Facebook says, what good is the vaccine if you constantly have to get a booster? So just to be clear, James, you don't constantly have to get a booster. I don't know for sure if people will ever have to get another booster. There are plenty of vaccines that actually have a first and second month, like where you think about the HPV vaccine, the original vaccination schedule for that was you actually got your first dose, and then a month later you got your second dose, and then 6 months later you got your third dose, and then you're done. You don't have to get any more of those for the rest of your life. I don't know for sure what the future holds. Might you have to get another booster a year from now? Might we see further mutations where, in fact, this is where the concern is that we could need to have boosters or sort of redevelop vaccines for that? We might. But what I can tell you is that right now, us getting past COVID is about the most important thing are people who have not yet gotten those first or second doses of vaccine. That's why I show that data at the beginning. That's who I worry about the most. But where we do see breakthroughs, it does tend to be in those older groups, and it helps everybody to keep that spread down. I will tell you that the vaccine remains very, very effective. It is by far the most important thing that anybody can do to protect their own health, their family's health, or to help get Chicago past COVID. And even if you don't get a booster, you've done the most. If you've gotten even one dose of J&J, you've done the most important thing. It's the folks who haven't gotten anything yet that are really driving a lot of the outbreak at this point. But the vaccine helps protect you. It also decreases your risk of transmitting COVID. That continues to be a misperception. Sometimes people think that the vaccine doesn't in any way stop you from transmitting COVID. It absolutely does, because you have to get COVID before you can transmit it. And then secondly, where people do have COVID in a breakthrough case, the time that they are potentially infectious, their symptoms, all of that is much lower. And so therefore, they're most likely to spread. All right, last question. I heard that I should think about spacing out the 2 shots for my young child because it builds their immunity more. Do you have thoughts on that? Yeah, I had heard this too. Thanks for that question. You should not space the shots out any further. You should go ahead and get the first dose and then get that second dose 3 weeks later. The vaccine is designed with that spacing in it to have your child get the first part of the immune lesson and the second part of the immune lesson. So it's not that spacing it out would somehow extend their immunity. What it will do is leave them a longer time without the level of protection. And some of the best data that I've seen at any point is how important it was for people to get that second dose of the vaccine. That's why I still tell people in my adult clinic, even last night, if there are folks who still have not been vaccinated and they only want to get one vaccine, I actually tell them to get the Johnson & Johnson vaccine, because if you're going to get one, that's the one. You don't want to just be sitting on 1 dose of Pfizer or 1 dose of Moderna and not get the second. The protection is not good enough, and that's true for kids too. Start certainly with that first dose, but please, everybody, I would strongly recommend get that second dose on time. If you've waited already, just get it as soon as you're able to, because that is when your protection is best. All right, lots of good questions in today. If we didn't get to you, we will try to get to you on Thursday. And in case we're not here on Thursday, if we end up doing a City of Chicago employee focus something instead, I do just want to wish all of you a happy Thanksgiving. I'm really looking forward to Thanksgiving, to being able to travel, to being able to gather, to really not have to worry about COVID in the way that I did so much last year. I love that I can say, yes, you can hug your kids and your grandkids. Yes, you can gather for Thanksgiving. The number one thing I am thankful for, let me tell you, is this COVID vaccine. The fact that it's available, the fact that at least everybody over the age of 5 is easily able to get it here in the city of Chicago. And the data is just really clear that this is the thing that helps us all get past COVID. So I wish you a happy and safe Thanksgiving. And please, if we didn't get to your questions, go ahead and put them in, and we'll pick them up either on Thursday or in the post-Thanksgiving Facebook Live. We will do a press conference at 1 o'clock today with CEO Martinez, as well as some pediatricians from around Chicago, to talk in a little more detail about what's happening with youth, to do a recap of our Vaccination Awareness Day, and to continue to remind Chicagoans of the importance of getting vaccinated now, not waiting a month or two. Now is the time to do it. So thanks again, and have a lovely holiday.